Hello, my name is Soraya Woods, and this is our presentation on personality disorders.
Hi, my name is Mariah Wakefield, and I had narcissistic personality disorder. It's basically characterized by grandiosity, a constant need for admiration, and a lack of empathy. Individuals with NPD often have exaggerated sense of self-importance, a preoccupation with fantasies of unlimited success, power, brilliance, beauty, or an ideal love. NPD affects approximately 1% of the general population. It often coexists with other mental health disorders such as depression, anxiety, and substance abuse, and symptoms typically emerge in early adulthood and may persist through the individual's life if left untreated. For the key traits, it's fragile self-esteem, need for admiration, lack of empathy, sense of entitlement, and exploitative behavior. The exact cause of NPD is not fully understood, but a combination of genetic, environmental, and neurobiological factors may contribute to its development. Traumatic experiences such as childhood, such as excessive pampering or excessive criticism, may also play a role. NPD can have significant negative effects on relationships. Individuals with NPD may struggle with maintaining healthy relationships due to their self-centeredness, manipulative behaviors, and lack of empathy for others. Challenges with this treatment include resistant to seeking treatment or may struggle to engage in therapy due to their belief that they are superior and do not need help. However, with appropriate treatment, some individuals with NPD can learn to manage their symptoms and improve their relationships. Lastly, remembering that while you can offer support and encouragement, individuals with NPD ultimately need to take responsibility for their own behavior and engage actively with their own recovery process. And how to help. Encourage the individual to seek therapy within mental health professionals experienced in treating professional personality disorders. Offer feedback in a constructive and non-judgmental manner when appropriate. Establish and maintain clear boundaries in your relationship with the individual. Model healthy communication. Dealing with individuals with NPD can be challenging and progress may be slow, but practice patience and persistence. And lastly, you can encourage the individual to engage in self-reflection exercises such as journaling, mindfulness, and meditation.
My name is John Birch, and the slide I'll be talking about is obsessive compulsive disorder, which is characterized by unreasonable thoughts and fears or obsessions that lead to compulsive behaviors. So what have you heard? In movies and on TV, obsessive compulsive disorder is usually portrayed as perfectionism or germophobia. Number 2, a major life event has to occur to commence the OCD. Number 3, people with OCD are rigid, entitled, rude, and downright mean around the clock. 4, Sheldon is a perfect example of OCD. Number 5, OCD is mainly about things like lights and household things. Okay, but what is it really? So in actuality, for number 1, only 1/4 or 25% of people with OCD have symptoms relating to germophobia and cleanliness. For number 2, OCD doesn't always have to have a reason why. Some people are just born with it. Number 3, most people with OCD are not rigid, pushy, or inflexible unless they're trying to perform a ritual. Number 4, Sheldon is actually the poster child for OCPD, which is a personality disorder where sufferers believe their way of doing things is the right way and the only way. And for number 5, obsessions present as intrusive, terrifying, and ego-dystonic thoughts that go against the sufferer's true values. And so what's the real? Many sufferers of OCD have thoughts questioning if they are child molesters because they aren't attracted to children. So like we said in the last slide, OCD, the bad part about it is it goes against the things that you value most. So if you know for a fact that you aren't a pedophile, then that's something that's going to be heavy. Or if you know you really love your mom, your OCD thoughts going to be like, well, kill my mom. So it can be really stressful to the person because it's their intrusive thoughts, but it's essentially on a loudspeaker. So this has been my presentation on this, and thank you.
My name is Soraya Woods, and I will be presenting borderline personality disorder. So what is BPD? Borderline personality disorder is a severe psychiatric disorder characterized by chronic instability, emotional sensitivity, impulsivity, and unstable relationships. 75% of people diagnosed with BPD are women. Men may be equally affected by BPD, but they may often be misdiagnosed with PTSD, depression, or anxiety or anger issues. These are some of the DSM-5 criteria: frantic efforts to avoid abandonment, a pattern of unstable and intense interpersonal relationships ranging between idealization and devaluation, identity disturbance and unstable self-image, impulsivity in at least 2 areas that are self-damaging, recurrent suicidal behavior or self-mutilating behavior, and inappropriate intense anger or difficulty controlling anger. So what causes BPD? There's no singular cause, but these are some of the well-known risk factors: abandonment in childhood or adolescence, disruptive family life in early childhood, such as broken family, divorce, abuse, and things like that, neglect and isolation in childhood or adolescence, sexual, physical, or emotional abuse is a super huge risk factor, and stressful or traumatic life events. In many people with BPD, certain parts of the brain were either smaller or had unusual levels of activity, such as the amygdala, hippocampus, and orbitofrontal cortex. All of these brain structures can impact emotional regulation as well as executive function and self-control. Here are some first-hand accounts of people who are diagnosed with BPD. These are accounts from male and female patients. As you can see, a lot of them feel like everyone hates them. They have trouble with concentration, trouble with identity, don't handle criticism very well, fear of rejection, anger, massive exhaustion. And as you can see, our female patient feels that people don't care about her. She feels like she hates people or people hate her. It's waking up and trying to be a new person every day. Go vegan, go goth, go hipster, go glamour, cut your hair. These are all things that a lot of people with BPD try to do in order to create a sense of identity. So here is the treatment that is most common for BPD: dialectical behavioral therapy. This incorporates mindfulness, skills to control intense emotions and reduce self-destructive behavior, finding a balance between accepting and changing behaviors, individual therapy sessions and group training and skills, phone coaching as needed, and the most studied treatment for BPD and the one to show the most effective treatment is DBT. Here's the prognosis for BPD. Without treatment, the risk of suicide in people with BPD is 40 times that of the general population. So treatment is extremely important. Risk of substance abuse is also much higher. Treatment can be very effective at decreasing anger, self-harm, and suicidal behavior. However, fear of abandonment and unstable relationships are much harder to improve due to their complex nature. Most symptoms subside with age, and many of them significantly reduce by age 40. My name is Soraya Woods, and thank you for watching.